Hello, I'm Kathleen Fairfield, and I'm here to present our work at the Portland Community Free Clinic about our rapid response during the COVID-19 pandemic. This is presented for the Maine Public Health Association annual meeting in October of 2020. I'd like to acknowledge our team from the Portland Community Free Clinic: Leslie Nickel, RN, PhD, who's the program director; Cole Fairfield, our volunteer summer intern; Bob Barrett, our public health nurse; and myself, volunteer medical director. Here's a view of the Portland Community Free Clinic on India Street. The COVID-19 pandemic has been particularly burdensome for the uninsured, many of whom are low income and work in service industries. Fear of medical bills is compounded with fear of coming to a medical facility to begin with, and resulted in a decrease in routine care delivery across the United States. Faced with the pandemic, Free Clinic staff established protocols for screening our volunteers and patients for symptoms prior to in-person clinics. We describe our experience with care delivery, including establishment of telehealth during this period. My learning objectives for this session include appreciating the adaptability of low-resource clinics to meet patient needs, deliberating between trade-offs of in-person care versus telehealth during the pandemic, and discussing opportunities for maintaining care of uninsured people during the pandemic. I'd like to start by describing our free clinic care model. The Portland Community Free Clinic provides comprehensive health care to patients at no cost for patients aged 18 to 65 who live in Southern Maine, primarily in Cumberland and York counties. Clinics are offered Monday through Thursday evening and Thursday afternoons year-round. We are a partnership of community volunteers, and we're supported by the Public Health Division, the Department of Health and Human Services, and the City of Portland, Maine. The Free Clinic refers patients to Mercy Hospital and Maine Medical Center for additional services as needed, including follow-up of any abnormal screening tests. Typically, the Free Clinic does not offer walk-in visits, though some patients do come in to ask questions about our care and later establish care via a scheduled evening appointment. Some patients also visit the Sexually Transmitted Disease or STD clinic, which is co-located at India Street. And they also establish primary care at the Free Clinic. Because of COVID, patients were unable to walk in with questions to the Free Clinic, and also fewer STD clinic visits occurred during the early part of the COVID pandemic. This may have decreased access. Prior to the pandemic, all patients were seen on site at 103 India Street. We observed that with the onset of the pandemic, many patients became reluctant to come in for care and have missed appointments where chronic disease management would have been performed. However, during the reopening, issues around patient care and staff safety demanded that the staff reconsider how services are provided, especially for counseling and mental health, which are lengthy face-to-face visits. Compared to the first 8 months of 2019, we observed that in 2020, we had fewer clinics overall since the pandemic began in March. The volume of patients seen in all visits is lower in 2020, driven by decreased in-person visits. The telehealth is now occurring since April of 2020. The majority of our volunteers are willing to come in and provide in-person care for general medical visits. This bar chart shows the 2019 clinics, all patient visits, and then in-person visits and telehealth. Total clinics are shown in blue. All visit volumes are shown in orange. In-person visits are shown in green, and telehealth are gold. However, we had no telehealth visits in 2019, so you see no gold on this chart. Compare that with 2020, which shows the same total clinics, all patient visits, and then in-person and telehealth. We see that our volume in January was similar to the prior year. In February, it started to decrease, and then markedly decreased in March and April during the early days of the pandemic. However, in April, we began to have telehealth visits, which increased our ability to do any visits at all and increased our total visits. We do also see that in-person visits continue to occur in April and May and have increased through August. We conclude that fewer visits and clinics are occurring overall due to the pandemic. Telehealth is supporting mental health care, but not fully meeting the anticipated needs of the uninsured community that we care for. Communication with patients around safety protocols is needed to reassure them that it's safe to come to the clinic and to maintain access to care. Our study has several limitations. These findings represent a single free clinic in Maine. Some patients and providers were not comfortable with the telehealth model, and we need to better understand this phenomenon. The majority of telehealth visits were for mental health. Primary care providers generally preferred to see patients in person at the clinic. We plan to continue to offer telehealth for patients who prefer this modality for mental health care. There is, however, continued need to offer in-person visits. The consequences of deferred care may not be evident for some time. If the number of uninsured patients rises due to the economic consequences of the pandemic, there may be greater need for care in free clinics or other free or low-cost healthcare centers. These are our references. In closing, I'd like to thank you all for your interest, and also particularly to our patients and volunteers, and to our 501(c), the Friends of the Portland Community Free Clinic. Thank you.